Hi, this is Brooke Lounsbury, registered nurse and expert contributor at CaringVillage. Each week I answer your questions about caregiving and offer tips and solutions. Medical disclaimer: although I am a nurse by profession, I am not your nurse. All content and information shared is for informational purposes and educational purposes only. It does not constitute medical advice and does not establish any kind of patient-client relationship. Always consult a professional who is aware of all the facts and circumstances of your individual situation before making any changes or decisions about your health or well-being.
When I visited my mom after work last night, she mentioned that her feet had been hurting her recently, and I noticed that they were both quite swollen. What causes this, and should I be worried?
What is edema? Edema is caused by too much fluid trapped in body tissues and cavities. Fluid moves outside of blood vessels and into what's called the interstitial spaces of the body. This is the moist spaces that are found between cells, organs, and body parts. There are several types of edema. Peripheral edema, which affects the legs, feet, and ankles, and the most common cause is chronic venous insufficiency, or CVI. Pulmonary edema is mostly caused by congestive heart failure and occurs when fluid collects in the air sacs in your lungs. Other causes include toxins, pneumonia, and some medications. Lymphedema affects the arms and legs and can be caused by damage to the lymph nodes, resulting in a blockage of the lymph nodes. Cerebral edema can happen when fluid builds up in the brain from a blocked or burst blood vessel or an allergic reaction or a tumor, be it either benign or malignant. Macular edema occurs when damaged blood vessels in the retina leak fluid that builds up in the part of the eye which is called the macula. The macula is a part of the retina at the back of the eye. We will be focusing on the two most common types of edema that affects older adults, and those are the lower extremity edema, which is caused by chronic venous insufficiency, and generalized edema, which is mostly caused by congestive heart failure. Now, before we jump into the two different types of edema, there are some edema symptoms that are a medical emergency and that they do require immediate medical attention. These include extremity and/or pain in swelling on one side that has gotten worse. One-sided swelling can indicate a blood clot known as a deep vein thrombosis. This is a medical emergency and should be evaluated immediately. Also, a new onset of pain or pain that has gotten worse anywhere in the body. New onset or increased difficulty in breathing or gasping for air, or even a new onset of frothy spittle. We will start by looking at chronic venous insufficiency, or CVI. Now, this is the most common cause of leg and lower extremity edema, and it affects about 70% of adults with leg edema. Other causes are infection, inflammation, liver or kidney disease, and leaky blood vessels. Blood vessels have microscopic gaps in them, and this can allow leakage of fluid molecules. In addition, malnutrition from extreme protein deprivation can cause edema. Understanding chronic venous insufficiency. Veins are the blood vessels that return blood to the heart so that they can be pumped to the lungs and get oxygenated. Veins rely on a system of valves to keep the blood from flowing backwards. Over time, these valves become less effective and blood can hang around in the veins longer than it needs to. This can lead to venous insufficiency. When venous insufficiency becomes chronic, edema and varicose veins can occur. Phlebitis, which is inflammation of the veins, skin ulcers, and cellulitis can result from edema. Risk factors for CVI include advancing age, family history, prolonged standing, obesity, smoking, sedentary lifestyle, lower extremity trauma, and prior venous thrombosis, which is blood clots in the veins. Treatment includes elevating the legs regularly, using compression stockings, reducing sodium intake, exercise such as walking to improve fluid movement to the legs, and ceasing smoking. The goals are to reduce the edema, prevent thinning of the skin, and to prevent or heal skin sores. Treating skin ulcers can require a wound care specialist that can put together a treatment plan. Skin ulcers are difficult to treat and can take months to heal. Generalized edema. Generalized edema affects the abdomen and is occasionally found in the lower and mid-back and also can contribute to edema of the legs. As fluid builds up in the veins, generalized edema is caused by congestive heart failure or CHF and is considered chronic when it lasts more than a few weeks. Chronic CHF reduces blood flow to the kidneys, which in turn causes sodium and fluid retention. Pulmonary edema. Pulmonary edema symptoms include shortness of breath, coughing, and breathlessness when lying flat to sleep. This is from fluid buildup in the lungs. CHF treatment frequently involves use of diuretic medications, also known as water pills. Diuretics are used to remove fluid from tissues in the body. However, they often remove important electrolytes such as potassium, which can result in dehydration and kidney injury. Some common diuretic medications are furosemide, spironolactone, and metalazone. CHF treatment can also include a low sodium diet and ceasing smoking. Now there are a few medications, actually quite a few, that can cause fluid retention. I've only listed a few of them, the more common ones that are antihypertensive drugs, corticosteroids, estrogen, progesterone, testosterone, and non-steroidal anti-inflammatory drugs, which includes the over-the-counter painkillers. The caregiver role in managing edema. Caregivers can play a valuable role in helping their loved ones with edema. A few of the things that they can do is review medications, and if your loved one's medications tend to retain fluid, ask their doctor for alternative medications. Check their skin frequently, especially their lower extremities for weeping skin, skin ulcers, or sores. Notify the doctor of any changes in skin integrity. Monitor blood pressure and weigh loved ones daily. Ask their doctor what parameters of blood pressure and weight they should call them for, both for high and low blood pressure readings and weight gain or loss. Monitor your loved one for increased shortness of breath. Assist the loved one in applying compression stockings if the doctor has prescribed them. If necessary, manage medications. If your loved one becomes dizzy or lethargic, notify their doctor. Offer sodium-restricted meals if prescribed. Encourage walks and movement to help move fluids out of tissue and into the lymphatic system. Encourage your loved one to quit smoking. And have your loved one elevate their legs as much as possible, especially if they have pulmonary venous insufficiency. If you have a caregiving question or concern, please submit your questions by leaving a comment below or fill out our form at www.caringvillage.com/questions. I look forward to hearing from you. Until next week.